Bismillahirrahmanirrahim. Rabbana atmim lana nurana waghfir lana innaka ala kulli shay'in qadir. Our Lord, complete our light for us and forgive us. Surely you have power over all things. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Rabbi zidni ilma, Rabbi zidni ilma, Rabbi zidni ilma. Assalamu alaikum and thank you for joining us on a Sunday night. We are all gathered here today under the umbrella of AMWPA, which is American Muslim Women Physician Association. It's an organization which has been around the Dallas-Fort Worth area for quite a few years now. And our main goal is to prevent disease, promote health and welfare, especially and the education of women. We are gathered here today because there is a very important topic that we needed to discuss, especially considering how COVID has increased, not only in older people, but in a younger generation, the most vulnerable of our population. So we felt it was very needed that we discuss what we can do to reduce the spread of this infection that is spreading way more uncontrollably in the last few weeks. Our format of the program today is that we will introduce you to the panel, who are basically two pediatricians here, who will be talking about the symptoms of COVID and how to prevent COVID infection and how to keep our children safe. And we will discuss the situation, and then we'll keep the, in the end, we'll ask you to ask the questions. There will be time for the questions, so please type in, but towards the end, because we'll be answering them once we are done. Since August 1st, the numbers of COVID infections, as you're aware, have gone up remarkably, not something that we were anticipating, and especially in younger people, in their 20s and kids under the age of 12. Since August 1st, most days the hospitals have been at capacity or near capacity all over Dallas and most of the country. There, as of Friday, there were no ICU beds available for any children in any of the children's hospitals. It is our responsibility as a nation to understand what the situation is and what can we do to prevent and keep our children safe. What are the steps we need to do? How aware we need to be of the current situation, and what are the things we can do to keep our families, to keep our children safe. 97% of children and adults who are hospitalized right now are unvaccinated. That is an alarming number. And this time around, the people who are sick are usually the ones who do not have underlying conditions. This is something no one anticipated 2 months ago. So it is, again, our responsibility to understand the situation and do our part in helping the situation and preventing what is now a huge health care crisis. It is not a religious or a political stance at this point. At this point, it is our responsibility as humans to take care of our own families, our neighbors, our friends, and our children. Let me introduce you to my panel today. First, I'll introduce myself. My name is Dr. Maryam Saleem. I'm a pediatrician. I work in a clinic in Arlington, and I also work in Medical City, Arlington. Next on our panel is Dr. Rani Siddiqui. She is a pediatrician who practices in Dallas and has quite a bit of experience with taking care of not only healthy children, but now with the advent of COVID, we are seeing children every day in our clinics. Second on our panel is Dr. Faryal Ghaffar. Dr. Faryal Ghaffar is not only a pediatrician, but she's also an expert at infectious disease. So I don't think we could find a better person to tell you what we need to do at this point. And she practices in Grapevine, Texas. I will start off by asking Dr. Rani Siddiqui to talk about symptoms of COVID-19 in children and the prevalence right now. Thank you, Dr. Rani.
Thank you, Dr. Mariam. Assalamu alaikum, everybody, audience. I hope everyone is well. Bismillah ar-Rahman ar-Rahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatan min lisani yafqahu qawli. This is a wonderful topic. Thank you to American Muslim Women Physician Association for putting this valuable program together. First off, I would like to say that now that children are back to school and in any capacity, first and foremost, all the organizations and schools are wanting for our children to be screened for symptoms. So the symptoms that we need to look out for as far as COVID-19 in the acute illness are fever and chills, cough, shortness of breath, difficulty breathing, muscle or body aches, headaches, sore throat, loss of taste or smell, which is quite unique to COVID-19, but I must impress upon everybody, it is absolutely not necessary to have these symptoms to still have COVID, which I believe is a big misconception among among people. And also any congestion, runny nose, any nausea or vomiting, and any diarrhea. Now, as you can hear, that is an all-comprehensive, all-inclusive list. And anecdotally, I'm sure my colleagues will agree that even symptoms outside of this big, long list are still being seen in children with COVID. One of the main things that I will mention, and is not official CDC symptom, but we do see it commonly, is abdominal pain and just general malaise, tiredness, not being well. So we do all need to be vigilant as far as screening our children for symptoms for COVID-19 in the acute phase. Another thing that I want to mention that is a very important point that, again, we see regularly is the misconception or the belief that some of these congestion or nasal symptoms or cough-related symptoms are attributed to allergies or a cold. So I think people don't understand that a cold or allergies in the face of our pandemic cannot simply be excused as not investigating these symptoms further. And especially if your child is in contact with other people, including a daycare or school setting, or in a, lives in a not. So in the face of a pandemic, I would actually proceed as COVID until proven otherwise. There are also some long-term, not long-term, but late phase COVID symptoms that we want everybody to be aware of. And that is a syndrome that we don't necessarily need to get into big detail about tonight, but this happens after an acute illness of COVID has already passed. And so those would include fever plus one of the following symptoms, either abdominal pain or bloodshot eyes, chest tightness or chest pain, diarrhea, increased fatigue, feeling extra tired, headache, any low blood pressure, neck pain, rash, or vomiting. So if you know or suspect that your child may have had a COVID infection in the recent few weeks, and then these symptoms occur, especially things that are, prolonged fever and just, unexpected rash, things of that nature, you really need to talk to your doctor, go see your pediatrician with your child. And I think that summarizes, at least for now, just the symptoms. Dr. Mariam, did you have anything else that you might want me to include in this piece before we move further with our program?
A question that we're asked quite often by parents, and I think that is going to be a question that's going to be asked again, is what do I do if I suspect that, it's COVID? When should I seek medical help?
Great question. So I would seek medical help right away. So if you notice that your child is exhibiting new symptoms that are not typical for them. You know, there are some children and patients and folks that do suffer from things like seasonal allergies, and they take their Zyrtex or their Claritins, or they, you know, are in daycare and they have a chronic runny nose. However, so if there are, you know, standard symptoms that are just always there across the board, perhaps it is okay to wait, you know, within reason, a day or two. But if things are persisting and not seeming like the normal, then at that point it is absolutely necessary then to call your pediatrician, call your, you know, family physician, whoever sees your child here, to seek more further medical advice. And then again, as I mentioned before, to get tested. And there are a couple different tests that I'm not sure if Dr. Faryal is going to refer to them, but I'm sure, you know, the more often we hear the information, the better. Repetition is the key to learning. So we have a few different tests for COVID-19, which are, you know, include rapid antigen testing, as well as PCR testing. Again, it's for the common folks, the audience, it's not really important what those testings are. However, I will say that the rapid test is more unreliable than our PCR test. And so our PCR test is the best we've got right now. So I would recommend that when you see your pediatrician and you have symptoms that fall in the list of what was just mentioned, then I would absolutely consult with your pediatrician and get your child tested.
I will go on now. Thank you so much, Dr. Rani. I'm going to ask Dr. Faryal Ghaffar a question because we, you know, first of all, she's going to tell us about prevention of the COVID-19 infections, and then specifically about the situation with the vaccines. Will you please unmute?
Can you hear me now?
Yes, we can hear you, Dr. Ghaffar.
Dr. Ghaffar, you're muted. Will you please?
Dr. Ghaffar, you're muted again.
Dr. Ghaffar, you're muted. If you can unmute your.
Okay. Now can you hear me?
We can hear you. Yes, we can hear you now.
Sorry about that. So when we talk about prevention of COVID-19 vaccine, COVID-19 vaccine itself plays a very important role in preventing the spread of this disease. Just remember that when you take the vaccine, it's not only preventing disease in yourself, it's also preventing your family members from getting the disease. For example, you may have children in the house that are less than 12 years old and they cannot get the vaccination. Or you may have an older individual in the house, like your grandparents, who may have gotten the vaccine, but they, because of their immune system may be a little weak, so they may not have mounted a good antibody response. So when you vaccinate yourself, you protect your whole family. So that's why I tell all my parents to get the COVID
yourself
vaccination.
if you're not the speaker.
Okay, then what are the other ways to prevent? Of course, we need to encourage that our kids and everybody that they should be wearing the mask. I see patients in my clinic, they're wearing the mask, but it's not the right mask, or they are not covering their nose and their mouth the way they are supposed to cover it. So I always educate them and tell them to teach their kids and all the individuals in their family on the proper use of the masks. Tell your kids, now the school has started, you know, they say the social distancing should be 6 feet, which is like 2 arm length. But with the situation going on with the schools right now, it's very difficult to maintain that 6 feet distance. So I tell the parents that at least tell your kids to try to avoid the crowded areas, you know, as much as they can. Wear your mask. If they are going to, if they have sneezing or if they're coughing, it could be from allergies, whatever, make sure that you change your mask. So give them extra masks to carry with them. Always sneeze in the elbow. Frequent hand wash. So you should teach them frequent hand washing. If there is soap and water available, that's the best way to wash your hands. But if you don't have one, it's not in the close vicinity, then make sure that the sanitizer that you use, the hand sanitizer, it should have at least 60% of the alcohol in it. That will be the proper way to, kill the germs. So those are the main preventative measures. And I encourage all the parents to, especially with this school situation going on, to teach the kids how to use the mask, how to frequently wash their hands, clean the and disinfect the areas in the house that are used repeatedly, the doorknobs, the surfaces in the kitchen that are used frequently, try to disinfect them. And monitor for the symptoms. As Dr. Rani Siddiqui mentioned, that if you have a child that has always has allergies and you give them allergy medication and they are not responding the way they are supposed to respond, then you should seek medical advice, because these are the kids who will be going to school or other places, and they are going to spread if you don't know that they have COVID and you have not quarantined them. Dr. Maryam Saleem, did you have any other things you want me to?
I would, yes. What I would want to ask is, and I think a question came right in the beginning, and we were going to talk about but I think it's okay if we kind of open the forum. There is some numbers on a question, and I don't know whether you can look at that, about the effectiveness or the safety of the COVID vaccine for children. Would you be kind enough to talk about that a little bit, please?
Okay, so as you know, for children, the only vaccine that has been approved is the Pfizer. That's the only one that's approved right now. There are more studies going on for the Moderna and the Johnson & Johnson vaccination, and there are more studies going on for the Pfizer vaccine for the younger age group, less than 12 years, which they are saying they're targeting towards this fall. But as far as the data from kids 12 and older who can be vaccinated with the Pfizer vaccine, it's quite safe vaccine. There have been cases of myocarditis that have been reported, and of course, a lot of parents were very worried about it, and they were calling me that whether they should vaccinate their kids or not because of that risk of myocarditis. When you look at the data, the cases of myocarditis, most of them, majority of them, they were self-limiting. Those kids got better on their own. They didn't require any medication or anything. And CDC and WHO said that these cases of myocarditis were most likely linked with that with the COVID vaccination, Pfizer COVID vaccination. But of course, you need to understand there are other viruses that are going around right now. Like there is one summer virus called enterovirus that we see all the time during these months, and it can cause myocarditis. But of course, if they are saying because they happen within few days to weeks after the COVID vaccine, they could be related. But as I mentioned, those cases were very mild. So if you don't get vaccinated and you get COVID infection and you get myocarditis, it could be way worse.
I would want to address, I'm sorry, I would want to address Mr. Imran Chaudhary did write a comment. I would respectfully disagree with the numbers, sir. Why I would say that is if you look at the numbers that have been around in children specifically, there have been around 2,000 deaths in the United States in children with COVID. And most of them are teenagers, and most of them are not vaccinated. And most of them have underlying issues like obesity, which we know 75 to 80% of children in the United States are overweight. So that is not a major diagnosis. As of Saturday, the ICU in Cook's Children's was full. And there were 2 children who were on ECMO, which is basically a very serious condition in which the risk of mortality can be as high as 50%. One child dying, one child's life being affected cannot be downplayed. Any human being's life cannot be downplayed. So we cannot downplay what the situation is. We were in a different situation in July, and we're in a very different situation since August. So we cannot say that this is not serious, or we cannot say that there is 99.7%, as the numbers you said, of recovery. Mortality is still 2%, but at the same time, morbidity is still there in adults. And the numbers we are seeing in children is not something that was there in June or July. So this is something that is very, very new. And this is something that we are barely starting. And the things as they are going have not peaked. It's going to get worse before it gets better. So first is we have to understand that this is a grave situation. And second thing is to understand what we can do to keep our children safe. We cannot be negligent. At this point, around 650,000 Americans have died of COVID-19. This cannot be, we cannot wait and say, well, this is not affecting children. And 2 months later, we have another number that we're going to be surprised by. We as physicians are seeing children sick. We as physicians are having children being sent to ICU with RSV and COVID at the same time. So this downplaying this at this point, when this is just starting, is not something that we should portray. We have to understand that this is a very serious situation right now for our children and for our young adults.
Dr. Mariam, I'm going to also add, in addition to all the important information that you just relayed, that since mid-June, which is only about 6 weeks ago, we have seen a 200% increase in pediatric cases. That is a that is an alarming number. So we were seeing 40,000 children a week with COVID-19 new cases per week. And that number is up to 120,000 children a week across the United States. And so, you know, again, mathematically, if you want to do the numbers and play out percentages, that is an alarmingly higher number of children that face a risk of morbidity and mortality. Morbidity meaning bad outcome, mortality meaning death. So, and again, you know, Dr. Mariam was telling us of Cook Children's numbers. I will inform you of Children's Medical Center Dallas numbers. They have 44 ICU beds in the pediatric ICU, out of which at any given time over the last few weeks, they have had 4 to 12 children admitted there with COVID. Currently, they have 2 children also on ECMO, which is, in other words, that means they're in a life-threatening situation. So I will relate, you know, we are all mothers on this panel. I'm sure that we have a majority, you know, mostly parents that are watching this segment. I know that I don't want my child to be among that 0.2 or 1 or whatever percentage that we want to come up with for a child that's going to be at risk for complications of COVID or potentially death from COVID. So absolutely, I'm going to 100% back up what Dr. Mariam said, that we can skew numbers one way or the other to, you know, comfort one side of the argument or the other. But we as pediatricians are on a day-to-day basis seeing children with real disease, with real illness. I will share my experience, and I've posted it on some social media just for perspective earlier as well. Just in 1 week, our percent positivity in my office has jumped dramatically from 1.7 to 10.7% over 1 week. And it is holding now steady for the 4th week in a row. I recently had to admit a child to the hospital, and I could not find a hospital bed in 2 local major children hospitals. So I had to send her to a 3rd hospital far away just to be admitted for respiratory distress. I also had I admitted a 17-year-old, otherwise healthy athlete female for COVID pneumonia, whose father had already been in the ICU for 11 days prior to that on respiratory support. So again, I would hate to be, and hate any of our audience or anybody for that matter at all, to be subjected to that sort of illness or you know, condition if it is preventable. Preventable again with masks, which really do work, and with vaccine that now we are lucky to have.
I have a question, and I will direct this one at Dr. Faryal Ghaffar. It's from a mother. It says, what should I look for when I vaccinate my child that is 12 years of age in case he develops myocarditis? Will I know if he develops anything within the first 12 hours, first few days? And if he does, how do I know when to take him to the doctor?
Okay, so if any child who, after getting the vaccination, few days to few weeks after getting the Pfizer vaccine, if they report that they have chest pain, they have palpitations, or they're feeling anxious, because some kids may not tell their parents that they are having palpitations. They don't even know what it is, but they feel, they look anxious, and the parents think that their heart is beating fast. They have difficulty breathing. Those are the symptoms that need to right away call the pediatrician, because those symptoms are not like one of those side effects. Like the side effect of the vaccination is mainly localized symptoms. Pain at the injection site, swelling at the injection site. They may have mild flu-like symptoms, but if anything is more serious, then they should be talking to their pediatrician.
I will ask the next question from Dr. Rani. This is from another mother. I have a 5-month-old baby and a 13-year-old. How do we keep our babies safe when they have siblings at school where masks are not being worn? Number 2 question, also by the same mother, is I was vaccinated while 9 months pregnant. Is my baby vaccinated? And if so, for how long could my baby be considered vaccinated?
Okay, so it is a tough situation to have school-age children when you are an infant or a young child at home, especially without the protection of a vaccine. The best practices that you can do to protect that 5-month-old child is for everybody else in the household to do the best that they can. So once again, I'm going to reiterate, mask wearing just for themselves. Until our situation with our leadership above in our state of Texas improves, which Allahu alam, not sure if it will improve, then we, at least within our own means, can mask. I think that actually wearing an N95 mask, if you have access to it, is a good thing, especially with the Delta numbers rising the way they are. Because we know that mask is proven to filter out the virus particle of COVID-19, as well as other respiratory illnesses for that matter. And also hand washing, good hand hygiene, doing the best you can to screen for symptoms. Again, I would not dismiss any sore throat, scratchy throat, nasal symptoms, any of that, all of the above. If you feel that you are coming on with any of those symptoms, do your due diligence to you yourself, or keep your children separated from your infant child. That is really the best options we have right now. As far as your 5-month-old, I would do my best to keep that baby home if you are able to. If you don't have to send that baby in, out to have exposures in any other environment, I think that's the best option for now, while we are among a rise in that Delta variant, especially in our pediatric population and across our US population for that matter. So there is not data to suffice that says that if you were pregnant when you got the vaccine, that vaccinates your child. So your child is not considered vaccinated. Perhaps there's some antibodies that cross through the breast milk if you are breastfeeding that baby, but there is no real data or evidence that shows that your child is now vaccinated against COVID-19.
I have another question, and I will answer that myself, I think. It's a question we get quite often. Mm-hmm. Is it safe to send young kids under 5 years of age to public school, even if they wear masks, or is it better to keep them home? This is a question that as pediatricians we are asked quite often, especially for children 5 years to 10. And I think myself, Dr. Faryal, and Dr. Rani all agree that we have seen a lot of problems that have happened, not just medically, but for younger kids when they did not attend school, the social isolation. But every family is different, and every family has different resources. It is very, very hard to social distance when they are in school, because there's really no 6 foot, space that can be done effectively. If you have a parent who is at home, who has the resources and the time to actually do the virtual teaching, it would be the safest thing to do right now. But at the same time, children who have special needs, children who have learning disabilities do need more help. But so the answer is different for every family. Knowing your own resources, what you have, but definitely children who were left at home with both parents at work, there was no learning, and it caused a lot of anxiety, depression, a lot of conversion disorders, children complaining of abdominal pain because of the fact that they were not getting any socialization or any positive reinforcements at home. So is it safe? Right now, it is not safe, but at the same time, you have to balance what are your resources. If you can keep the children under 5 at home and there are no issues, it would be safer. From the age of 5 to 8 and 9, definitely think of your child's personality, their needs, and your resources, and make a decision that would work out for your family.
Dr. Maryam Saleem, I just wanted to mention one thing. Can you hear me?
Yes, yes.
Okay. One of the things I just wanted to tell all the parents that I was seeing a lot of patients, kids that were not brought to the clinic for the control of their asthma, or they were not getting vaccinated. And now those numbers have increased. But I urge all the parents to make sure that take their kids for their medications to the pediatrician for their vaccination, because you need to understand that COVID is a viral infection, but there are these kids can get secondary bacterial infection, and that could be prevented through routine vaccinations. And I have one patient, he was admitted and he was not taking his inhaler because he wasn't seen in a long time. He did not follow up with the pediatrician. So he got sick and he got hospitalized after getting COVID vaccine, COVID infection. And I think that could have been prevented if this mother went to the doctor, to the pediatrician, and got his asthma control medication. So I urge all the parents to make sure that they need to, if they have any, questions about what precautions the pediatrician is taking, for seeing sick as well as the well child under the same roof, they can talk to the pediatrician about the safety measures they're taking, but they need to take their kids for routine vaccination and other taking care of their underlying conditions like asthma.
Absolutely, I 100% agree, Dr. Ghaffar. So not just for their vaccinations at the, various intervals, but just in general, even if they're not due for any vaccines, any routine childhood vaccines, I do encourage patients to continue to come in for their well child checks. So growth, development, across the board, just general well-being. We have seen that suffer because of hesitation to stay up on well care and focus more on COVID care, or, it's a little bit, I know it sounds very frustrating because on the one hand, we're saying, please eliminate your exposures, but yes, absolutely. Please talk to your doctor's office and see what parameters and measures they have in place. One tip may be to get the most appointment in the morning before the rest of the patients come in, so that, you have a clean slate. Find out what practices your offices have. Just for my own personal example, we spray the room in between every patient. And so all the tables, chairs, everything's countertops are wiped down in between every child, whether they're coming in for well visit or a sick visit or something that's COVID related or not COVID related. We are very careful as far as known exposures. We have different pathways that those patients enter and exit the office. At one point in the thick of the pandemic, we had actually literally separated our office suite into a well side and a sick side so that there was no crossing of pads in between. So your offices will have different measures in place. So please don't shy away from well care. I'm sure, across the board, the offices are taking strong measures and acting responsibly. And again, just keep in close touch with your office and maintain your well care as well.
One question that is asked here is it safe for my kindergartner to go to school if he's the only one who's wearing a mask? What can be done to keep him safe? And is it okay for him to go to school considering the situation with the masking right now?
Boy, that's a tough one. That is really tough, because if the entire class is not masking, I'm not really sure what to say other than perhaps, you're going to be your child's best advocate.
Yes.
And so I can again share my own personal experience. I've spent countless hours emailing and talking to the school boards of my children's schools to, show that or to voice my concern. I'm not the only parent. And I think that is something to be said as well as far as child advocacy and advocating for your child. Talk with your teacher, talk with your principal, talk with your school board to see if there are some changes or some considerations that can be made or special provisions that can be made for your child. Maybe you can have some kind of arrangement for your child to sit separated from all the rest of the classroom, at a better distance. Maybe during the lunch hour, they can make some accommodations to, have better distancing and better separation between the children. You can send your lunches from home so the child doesn't have to go through cafeteria lines, things like that. I mean, there are creative ways and situations that we can think outside the box to, analyze your child's day, their school activity, and then make requests as well as teach your child. Now, again, a kindergartner, I will absolutely admit I have a first grader, so not too far off, is difficult to teach because they're not an adult to be responsible for themselves. And so of course they need the adult supervision, but to the best of your ability, make sure that teacher knows that my preference is to have this child in a mask at all times when possible. So please make sure that you're watching my kiddo, that they've got a mask on all the time. Please emphasize the hand sanitizing. Please put them at a distance in a classroom. Please, make better arrangements for my lunch hour when all the masks are off. Things of that nature, recess time, maybe have a different activity for that child or make sure that that child is, again, outdoors and in good ventilation, things of that nature. So again, I feel for you. You're in a very tough spot. Maybe get together with some of the other parents of those children and express your views, your concerns, to have a valid discussion about some of the information that you have or that you're getting. Without conversation, without advocacy, we really can't move too far. So I think there is something to be said about being proactive from your own end as well.
There's a question, and I think we touched it a little bit, but maybe
Yes.
we can talk about it again. The question, I'm going to direct this one to Dr. Rani. What kind of symptoms we have to look for post-COVID or MISC?
Okay, so I read off a list. I will read it off again just so I don't forget, because we know these symptoms so well, but we take for granted that others don't. So MISC, according to the CDC's website, and so the cdc.gov is a good resource that you all should be equipped with. Put it in your toolbox so that if you have questions similar to this, you can refer to that website as well. But the CDC website says, let me pull that back up. The CDC website says that the symptoms to look out for with MISC, which is multisystem inflammatory syndrome in children, is a fever and one of the following symptoms. So you would see fever and either abdominal pain, bloodshot eyes, meaning like red eyes, chest tightness or pain, feeling extra tired, more than usual. A lot of our kids complain that they're tired, but if it's something out of the ordinary, like for example, some people will say, my kiddo fell asleep the entire way home. That's not usual for him. Or as soon as she came home, she just crashed on the sofa, or she fell asleep at 7 o'clock when normally bedtime is at 9 o'clock. Things of that nature that is atypical for your child. Headache, low blood pressure, neck pain, rash, vomiting. Those are all symptoms that fall, that are included in the MISC syndrome, in addition to a fever.
And what you have to remember is this is not in the acute phase. This usually can be a few weeks later. So a history of having COVID can be very, very helpful. Right now, most of us are very aware and we'll ask that question. But at the same time, this is not something that happens in the acute phase and can happen later. So there's another question that I will direct it to Dr. Faryal. And again, at the same time, because she is not only pediatrics, but also infectious disease. So I think it's an appropriate question for her. The question is that, where did it go? there are a lot of reports coming out that vaccines are only effective for 8 months. I don't think I've read a report that is consistent like that. After that, we'll have to get boosters. Will our kids have to keep getting boosters?
Okay, so the studies so far has shown that the antibodies go down close to 8 months after the vaccination, but there is no proof whether those less amount of antibodies are still protective or not. So they may still be protective, but because this is all based on the quantity of the antibodies that it goes down, they're recommending a booster dose. For immunocompromised individuals whose immune system is very weak, and of course it depends on how weak it is, and that the specialist can decide. So far it has been approved that they can get a booster dose after they complete the second dose of so if it's a Johnson's & Johnson's vaccine, of course, they got only one dose. And if it's the Pfizer or the Moderna, they get 2 doses. So after those 2 doses, they are supposed to get a third booster. For other individuals, normal individuals who have a normal immune system, they are going to come up with a recommendation soon. And this is what they are saying, that most likely it will be 8 months after the completion of the second dose of the vaccination.
Mm-hmm. But as of right now, the booster is not recommended for anyone but the immunocompromised.
Yes, exactly.
It's
so they are doing they are doing some studies for the normal individuals, but that data has not been approved yet, and they have not come up with the recommendations. The only one is for the immunocompromised host. Dr. Maryam Saleem, there is one thing I really want to tell the parents is kids who have gotten COVID infection and sport, when they go for the sports physical. So I have a lot of these parents will come and they will not mention that their kid had COVID infection when they come for the sports physical. Please make sure that you let the doctor know, because you might have gone to an ER or an urgent care, and then, you know, maybe it was a few months ago or a few weeks ago and you forgot all about it because the kid is doing fine now. Because there are special recommendations by American Academy of Pediatrics and CDC that kids who had mild COVID infection, like, you know, just some flu-like symptoms and fever for less than 4 days, they will be okay. If everything is, they are doing fine, they can go back to sport activities as usual. But whoever had moderate infection to severe infection, they need to be seen by the pediatrician, and they may be referred to a cardiologist for more testing like EKG and echo. So make sure when you go for these sport physicals, or you're going to an outside facility, like a lot of people are going to care now and urgent care to get those forms filled, please mention it to them. If your child had COVID-like symptoms, he was tested, or you suspected, he was never tested, but you suspected there was possible COVID infection going on, you need to let them know, because it's very important when they go back to play sports that they are healthy and there is no risk involved.
I will ask the next question and I'll direct it to Dr. Siddiqui. The question is, how can you trust teachers who are not wearing masks? Do you not think that the children should stay home with homeschooling? Dallas County has virtual schooling.
So again, I think we've addressed that question as far as homeschooling or keeping your child at home. You know, our recommendation, all of us agree that if you are able to keep your child at home and you have the resources to homeschool your child and supplement their education at home, that's great. We should absolutely, you know, do that or take advantage of that right now with the situation being bad for Delta, and we don't know if it will worsen going forward. But you know, that's not a blanket statement for everybody, because we have working parents, we have parents that aren't able to supplement education, we have children that don't do well in the home environment that have special needs. You know, not everybody is going to be an amazing, you know, child and a fast learner, and a parent's going to be a wonderful teacher. So again, if you know your situation, you know your child, you know your strengths, by all means, keep your child home. But if you have limitations, then do the best that you can with what you're given, you know, to keep your child safe with all the strategies that we have mentioned thus far. Now, teachers not being wearing masks, there's a comment earlier here in the chat that I think is worth mentioning, that somebody had mentioned that they work in an urgent care, and over the last couple of weeks, they're seeing more and more teachers coming in that are COVID positive. And we are seeing just that. So we're seeing lots of staff, lots of students that are testing positive, and those numbers continue to increase by the day. So that's the whole reason we're here doing this talk right now, is because the situation is not great, and it's continuing to worsen just by the climate of where we're at. So with more people getting more illness and more disease, we can only expect more folks getting sick, more people getting, more cases being reported, more people in the emergency rooms, more people in the intensive care units, which is why we are trying to emphasize prevention strategies by promoting mask wearing, by educating folks on vaccine, trying to dispel myths about vaccine. If it's reassuring for anybody at all, I know Dr. Ghaffar, Dr. Saleem, and I, since from in July, August, for the last 4 to 5 months, we are seeing vaccinated children that are 12 and above coming through our offices on a daily basis that are doing well. There's no crazy reports of the vast majority of children of having terrible side effects. So, that is something to be said. I mean, I can understand folks with some vaccine hesitancy, and I can understand folks that are wanting to wait. But this many months later, this much time later, I think we should all feel comfortable across the board that vaccine is safe and it truly does prevent bad illness. So there's the vast majority of our intensive care cases, as well as our hospitalizations, are 99-point-something% unvaccinated folks. So we should look at that information and look at those numbers and really, come to comfortable conclusions about vaccinating our 12 and up children as well.
Another question is, and it's from a parent, and it says, are elderly parents considered immunocompromised? Not really. Just age is not a reason to be immunocompromised, but if they have some medical conditions that decrease their immunity, or they are on medications that decrease their chance of fighting infection, then they would be immunocompromised. But just by age, they are not considered immunocompromised.
Yeah, CDC has on their website the conditions, like if they are on high dose steroids or cancer medication, and they had just had a transplant and they are on medication for post-transplant, which will affect your immune system, then those are the ones that are considered immunosuppressed, like those are the moderate to severely immunocompromised hosts, and they are the one who will be recommended to get the booster dose. So the CDC website has all those conditions, but of course you need to talk to your doctor and the specialist to find, if they are really immunocompromised or not.
But just that age would not be,
but
right?
Age is not the, elderlies are not, they are not considered by the age. As far as you just take the age, they are not considered immunosuppressed.
I have a question, and I will direct this one at you, Dr. Faryal. Is there, and we get this question quite often, is there a high risk for a child to get myocarditis when they have got the vaccine, if they had COVID before?
Okay, so the question is that if they get the vaccine, as I already mentioned, that there were a few cases of myocarditis that were possibly linked to the COVID vaccination, but they were very mild cases. Majority didn't require hospitalization or treatment. Now your question is, when they get the vaccine or if they had a COVID before, I don't think so there is any data on that. So of course, after the COVID, natural infection with the COVID, you are at risk of myocarditis like any adult, but I don't think so there is any data that I have seen that if you got the COVID infection and then you had the vaccine, then you were more likely to get myocarditis.
This question, I'm going to direct the next one to Dr. Siddiqui. Is there any treatment for mild COVID for kids or even moderate symptoms? Does the pediatrician give any prescriptions?
So Again, in general, if it's, COVID symptoms that follow like an upper respiratory tract infection, sort of a pattern, there really is no treatment for COVID-19. It's just basically, comfort measures and symptomatic treatment, things that you would do for, cold symptoms or fever symptoms. You want to do fever control with Tylenol or ibuprofen. You want to do, they have nasal drainage, cough, that type of thing. You can do some things to combat that, such as a steam shower or, so breathing the steam deep penetrates some of those airways and really helps alleviate some of that congestion and mucus. Saline drops are a wonderful nasal wash to, do some saline drops and some nasal suction with that. Basically keeping your child comfortable, making sure they're well hydrated, that they don't get dehydration, because a lot of times with any illness, children, when they feel sick, they don't want to eat or drink. So eating can take a back seat, but you want to make sure that you're pushing fluids and keeping your child hydrated. And then again, just very good vigilance, because if your child starts demonstrating increased respiratory distress, having more trouble breathing, where it's labored breathing, and there's a big distinction between labored breathing and fast breathing. And if I may, I actually describe it to my patients as so you can have fast breathing when a patient has fever, and that is usually, if you analogize it as a dog panting versus breathing really hard. So a fever may cause some increased respirations, kind of a fast breathing versus very labored breathing, where their entire body and their muscles and their ribs are involved. And you see a lot of the nasal flaring and some neck muscles and accessory muscles here being used. So the fast breathing may be attributable to fever. And if you can keep that fever controlled with some medications and cooling down and, wash rags and a warm bath, etc., that would be helpful. But if you notice the respiratory distress, that is a big red flag that you need to seek care urgently, after you've done your various measures of trying to suction nasal saline, et cetera. But as far as real treatment, again, if you have a child that maybe has asthma or some underlying conditions that, of respiratory underlying conditions, there are some folks situation dependent that you could maybe perhaps use some steroids, oral steroids or steroid inhalers, or rescue inhalers such as albuterol. And again, it will be situation and child dependent. But there's no Regeneron and things like that are, for kids, unless if you're 40 kilos or 12 years older and in the inpatient setting. So as far as, I think the question really addressed for moderate symptoms and pediatrician giving prescriptions, there's really not, any prescriptions other than maybe perhaps some steroids and some inhalers for respiratory support, depending on the child and their history. Dr. Saleem, Dr.
And that goes with, pretty much mild and moderate symptoms, even for adults, because you have to remember this is a viral infection. There is no role of antibacterial or antibiotics.
Mm-hmm.
So it has to be, you've got to trust your doctor, you've got to know your symptoms, you've got to keep yourself hydrated, and know most adults will also have, with minimal symptoms, will need symptomatic treatment. So that is what the answer for that is. Tylenol, a question is, Tylenol is okay versus Motrin? I think Motrin got a lot of initially because there was concern when COVID started that maybe that would create increased symptoms or not be, was actually considered contraindicated. But over time, that myth has been, debunked. You can absolutely alternate Tylenol with Motrin without any issues, keeping the fevers down, keeping the child hydrated, keeping an eye on the breathing, and keeping them isolated from the rest of the siblings, wearing a mask around the child when they are positive so that you do not get sick, especially if you're not vaccinated. But at the same time, at this point, as adults, please get your vaccine. We have to step up. We have to take responsibility. We cannot let the next few months be harder or look like how it's looking right now. We are not at 50% in Texas as of yet when it comes to the vaccines. The number of vaccinated teenagers is comparable to what the adults are, but the adults could have done a better job. We all hoped, and again, I say that on, as a mother, that we all hoped in May, we were hoping that, the numbers would be much better and our children maybe wouldn't need the vaccine. But how the numbers are looking right now, and how things are for our children's education, for their safety, for their health. Adults need to get vaccinated to keep your neighbors safe, to keep your family safe, to keep your work environment safe. For all, we cannot afford, and again, if we go in a second shutdown, mental, financial, physical, we are already exhausted, all of us, not just the healthcare professionals, but business owners, mothers, parents, everyone is stretched thin. So be kind, be vigilant, understand the situation, take responsibility, and take care of yourselves.
One thing I'm going to mention, since the acetaminophen and the ibuprofen topic came up, I will mention that before you vaccinate anybody, child or adult, please be sure to not pre-medicate with a fever reducer, because you do want that vaccine to mount its proper response. Once the vaccine is administered, and later, if you do have symptoms of muscle aches, pains, fever, soreness, chills, etc., at that point, it is absolutely fine to medicate. But do not pre-medicate before the vaccine in anticipation of it.
I'll direct the next question to Dr. Ghaffar. The question is there anything we can give? This is a question we get quite often, and there are quite a few answers for that as well. Is there anything we can give to our kids to boost their immune systems before they get caught? Things like vitamin C. If so, which kind? Also, are there any kind of herbs that you recommend?
So it's not proven that, you give a certain kind of herbs or vitamins, it will prevent. But as we have seen with any viral infections, if you give your kids multivitamin that helps, like vitamin C, zinc, and those are all included in the multivitamin that you give routinely to your kids. There has been some data that if you give overdoses of vitamin C and zinc, that could be detrimental to the health. So I just tell the parents, I say, just keep giving them the multivitamin, as you usually do, but don't give overdoses. And if they have COVID, mild symptoms of COVID, make sure they rest, they take enough fluids, give them their vitamins. If they want to take some orange juice, just the usual things that you'll do for any kid with a cold.
I'm going to add to Dr. Ghaffar's comment, actually. So absolutely, there's no hard data that says that vitamin D is a proven, treatment against COVID-19. But there's many studies that do show that vitamin D plays a role, or can play a role, or potentially has played a role in illness and disease and getting COVID-19. So, and across the board, we are all vitamin D deficient anyway. And so just in general, it is good practice to take some supplemental vitamin D. And again, it would be age dependent. So you need to talk to your pediatrician about what the right dose would be. But if you can supplement in addition to their multivitamins, some vitamin D, it is beneficial. So not only is it good for, in general growth and bone development, et cetera, but it is a key immunomodulator that could potentially play a vital role in viral infections, including COVID-19.
The next question is, if a child is vaccinated and wearing a mask, is it okay for them to be in-person learning?
So that's the goal. I mean, that's the goal that we're trying to achieve.
Yes.
To get folks, at least somewhat functional to the best of their ability with the best prevention measures that we've got. And so the best prevention measures that we've got is exactly the, couple things that we've been trying to emphasize. So, I'm not, is it okay or is it not? I mean, again, you have to really judge your factors and your strengths and your weaknesses and your risk factors, et cetera. But that's the goal. With vaccine, they have protection. With a mask, you have protection.
There's a question. There are lots of reports about Israel is 80% adult vaccinated. 70% hospitalization is also vaccinated. Vaccination breakthroughs are becoming more prevalent. Again, at the same time, the numbers we are getting here in the United States are not matching that. And the numbers, if I'm not wrong, was something like 97%. Yes, there is breakthrough infections, but hospitalizations are still 97.7% in the unvaccinated people. So it is, if it's not protecting you from infection, it definitely is protecting you from moderate to severe disease and especially death and hospitalization. So majority of the numbers of people hospitalized are actually unvaccinated.
There are health experts that are calling this COVID-19, especially with the Delta variant, the pandemic of the unvaccinated. Those are very heavy words, and what we're seeing across the board really supports that statement. So, you know, hopefully people will make some good educated choices. And again, just because we are vaccinated does not 100% leave us off the hook. We still have to do our due diligence with masks in indoor places, avoid crowds, do hand hygiene, keep distancing. And so, you know, I don't think that the argument is good to say, well, if I have to do all that anyway, why get a vaccine? Because again, we are seeing that the sheer numbers of people that are getting hospitalized and having bad outcomes are the unvaccinated. And so at this point, to get vaccine is good practice to protect yourself and your children that are eligible.
I think we have answered quite a few questions. I would want Dr. Faryal to make a closing statement, and then I'll ask you, Dr. Rani, to also make a closing statement about the situation and your recommendations.
So I will say prevention, and that is by vaccination. Yeah, you can take other measures, social distancing, washing hands, but the major implementation to prevent this disease is vaccination. And you know that the vaccine has been approved for 12 and over. As soon as it gets approved for the younger age group, you should start vaccinating your kids. And that is the main goal. And that's what will help us with this pandemic.
Absolutely. And, you know, for the general audience out there, obviously these are concerned families and parents that are tuning into this program. So I will say that to have a hard notion of yes vaccine or no vaccine, or yes mask or no mask, I would urge everybody to rethink, you know, a hard notion on being anti-prevention measures. You know, there are many folks in the audience that will say, well, you know, if it's going to happen, it's going to happen. And ultimately, it's not up to me, it's up to God, etc. Absolutely, 100%. You know, we are, as the Muslim Women Physician Association, believe in that concept as well. However, there is a concept of tie your horse. So we absolutely have to do the best that we are given with the knowledge that we are given, with the resources that we are given, and with, you know, to do the best that we can towards that goal. So I hope that that resonates with some audience members across, and again, to dispel some fears about vaccination in children. I have seen many for the last 4 months, you know, hundreds of patients that are already fully vaccinated and partially vaccinated that are doing fantastic, that are doing great, 12-year-olds and older. You know, and so the reports that we hear of side effects or the, you know, heart illnesses, the pericarditis, myocarditis, are a very small percent of those children. And again, the argument can be made that a very small percent of children get very sick with the disease as well, but we are just not seeing that at the moment. So again, our ICUs are getting more and more full. Our hospitalizations are getting more and more full, including in the pediatric population, which is why we are in this situation and trying to reach out to our audience today. So I wish everybody well. You know, may Allah subhanahu wa ta'ala protect all of us and all of our families and our children, inshallah. And, you know, please, I guess, feel free to reach out to us if we can be of any more assistance.
Thank you so much, Dr. Ghaffar. Thank you so much, Dr. Rani. I think we come to the conclusion of this talk. I thank all of you for joining us. And I pray that we stay safe, we stay responsible, we stay educated, and we make a conscious effort to do our part, to keep our children safe, to keep our families safe, to do our jobs right. So please get a vaccination if you're eligible. Get your children vaccinated if they're at the age that they can be vaccinated. Be good role models, wear your masks. With the, you know, if you wear a mask, they will wear a mask. Teach them how to wear a mask, correct them, and guide them so they can have a healthy childhood. That is our responsibility at this point. So thank you, God bless, and Allah Hafiz.